Diagnostic methods of traditional Chinese medicine. Diagnostic methods, as a component of traditional Chinese medicine, refer to the basic methods to examine a patient and collect data about a disease. The diagnostic methods of traditional Chinese medicine can be summarized into four kinds: observation, auscultation and olfaction, interrogation, and pulse feeling and palpation. The four methods, each being of unique functions and significance, are closely related to one another and should all be given an equal amount of attention. Only when a physician makes a comprehensive use of these methods can he come to a correct diagnosis. Observation means that a physician utilizes his eyes to make a systematic and purposeful examination on the relevant body parts of a patient and on the secretions and excretions of the patient. According to traditional Chinese medicine, the changes on one's external look and expression are in essence the reflection of the activities and changes of his or her internal organs, vital energy, and blood. Observation is made on one's look, complexion, shape, eyes, tongue, skin, and excretions for a better understanding of the symptoms of a disease, with special attention paid to the face, eyes, and tongue. Tongue observation, a method to diagnose and determine the disease by examining the coating on the patient's tongue, is the most distinctive method of observation in traditional Chinese medicine. Auscultation and olfaction is a diagnostic method based on listening and smelling. By listening to the voice, breath sounds, and coughs of a patient, and smelling the patient's breath, body odor, and excretions, a physician is able to determine whether disease is caused by chill or fever, or whether the disease is caused by deficiency or excessiveness. Interrogation means that a physician asks a patient or the patient's companion systematic and relevant questions in order to learn more about the patient's condition. Information such as the patient's physique, living habits, reasons for the disease, incidences and treatments, subjective symptoms, case histories, and family medical history can only be obtained through a detailed inquiry. The fourth method is to make an examination by touching the patient's body, including pulse feeling and palpation. A physician gets to know the illness by pressing and feeling the patient's pulse and by touching and pressing the skin, hands, feet, chest, abdomen, and other parts of the patient's body. Pulse feeling is a specialty of traditional Chinese medicine, to which great attention has been attached by Chinese physicians of all generations. While discovering the functions of blood circulation, ancient Chinese recognized that the stimulation from various internal and external factors might result in the changes of the blood circulation, and that the pulse conditions could tell the state of disease and the conditions of the patient's internal organs, vital energy, and blood. Through a long course of clinical practice, traditional Chinese physicians have accumulated a rich collection of pulse theories. There are as many as 28 common types of pulse conditions, in addition to the abnormal types, which only occur under dangerous circumstances. The diagnostic methods of traditional Chinese medicine have a long history in China. According to historical records, the four diagnostic methods mentioned above were first created by the famous physician Bian Que in the Warring States period on the basis of the experience of former experts. The Yellow Emperor's Canon of Internal Medicine, the earliest medical book surviving in China, was written in the Warring States period. Through a detailed description of a good many diagnostic methods and an introduction of the principle of their comprehensive use, the book laid a foundation for the 4 methods of diagnosis. The diagnostic methods of traditional Chinese medicine are a complete set of methods for diagnosis formed in the long history of medical practice, embodying the traditional characteristics of diagnosis in Chinese medicine and the distinctive cultural and regional features in China. In 2006, the diagnostic methods of traditional Chinese medicine were added to the list of China's national intangible cultural heritage.